Welcome students. Today we will start with anatomy of female reproductive system. The first organ that we will take is ovary. So ovary is the female gonad. तुम सभी को पता होगा gonad female में कौन सा होगा ovary and in males it is testis. In females ovary is going to produce the ovum for reproduction and in males the testis will produce sperms. So now जैसे मैं हर प्रोग्राम में बोलती हूँ कि एनाटॉमी में हमें पढ़ना है उस मॉर्फोलॉजी. पहली बात वो ऑर्गन कैसा दिखता है, कहाँ पर होता है, क्या करता है, उसके क्या रिलेशंस होते हैं. ओके, सो ओवरी इज एज द नेम सजेस्ट almost oval in shape. It has got upper pole. Now here you will see it is horizontal, isn't it? This is because in nullipara the ovary is vertical. It would be vertically like this. But in multipara woman it is horizontal. So if we take it as we are studying a nullipara ovary. Nullipara means a woman who has not yet born a child. यानी अभी तक जिसका बच्चा नहीं हुआ, that person is called, female is called nulliparous. Okay? तो हम वही जो है उसे हम normal लेके चलते हैं. So we have got the ovary which has got a upper pole and lower pole, two borders, anterior border, posterior border. एंटीरियर और पोस्टीरियर बॉर्डर होगा तो दो सरफेसेस होंगे, लैटरल एंड मीडियल. फॉर एग्जांपल आई विल जस्ट फॉर अ सिंपल रेफरेंस आई विल टेल यू. इफ यू टेक इट समथिंग लाइक दिस, ओके, सो अपर बॉर्डर, लोअर बॉर्डर, अपर पोल, लोअर पोल, एंटीरियर बॉर्डर, posterior border, then we will have, if it is on the right side, the lateral surface, medial surface. Okay, so now lateral surface will be near to the pelvic region, so it is also known as pelvic surface, and this medial surface it is towards the uterus, so it will always also be called uterine surface. Upper pole is related to the fimbria of fallopian tube, so it is also called tubal pole, and the lower pole is towards the uterus, so it's also called uterine pole. So these are the, in simple way, if we will say, it has got upper pole and lower pole. So you have to remember just two poles, upper and lower pole. You call this upper, okay? Presently this is lateral and this is medial, but if it was nullipara this would have been like this, vertically. So upper pole, lower pole, two borders, anterior and posterior. So anterior border, posterior border, two surfaces, lateral and medial. So what is the dimension then? Dimension, it is again very simple. Just remember three numbers, a difference of 1 centimeter: 1.5, 2.5, 3.5. So 1.5 centimeter thick, 2.5 centimeter broad, 3.5 centimeter long. Simple. Now where it is located? It is a pelvic organ, so it is located in the pelvic fossa. But where? Laterally, isn't it? Because you can see here that in the center we have got uterus, then the fallopian tube, so this has to be present laterally. So it is present laterally in the pelvic fossa, and that portion where the ovary is present is called ovarian fossa of pelvis. Now the relations. Anteriorly it is related to the obliterated umbilical artery, and posteriorly it is related to ureter, which is coming from kidney and it will enter the urinary bladder, and urinary bladder is present anterior to uterus. So it has to come from behind forward. So posteriorly it is related to ureter and internal iliac artery. So this was a simple relation, but otherwise if we see about the peritoneal relations, the peritoneum is covering the whole of the ovary except its anterior border, because all the structures that you see here, uterus, fallopian tube, it is all surrounded by a fold of peritoneum, something like this. Okay, if I will say, this is the peritoneal fold which is covering the uterus, okay, and on the sides two fallopian tubes, and near the end of the fallopian tubes is the ovary. So this broad fold of peritoneum which is covering all these structures is called broad ligament. And when this broad ligament, it is covering the ovary, as I said. Now when it will cover it, suppose you just see the posterior border is covered, all the surfaces are both the surface covered, lateral surface, medial surface, upper border, upper pole, lower pole, but it has to be open anteriorly. Okay, why? Because it is not fusing here. Anteriorly anterior border is not covered by this fold, and here we can find two layers very distinctly present, isn't it? Two layers of this peritoneum. So these two layers together are called meso-ovarian. So these two layers are going to continue as the broad ligament of uterus. So the anterior border is not covered by peritoneum. Instead, the peritoneum which is covering the ovary all around is reflected from the anterior surface, and it continues as the broad ligament of uterus. So that portion is called meso-ovarian. Now we have got two ligaments of ovaries. One ligament which connects it with the fallopian tube, and the other which connects it with the uterus. See, one which is connecting the upper pole with the fallopian tube, and this one connecting the uterus with the lower pole. So this ligament between the lower pole and uterus is called ovarian ligament. Okay, and you can see it is just near the junction where this fallopian tube is also opening in the uterus. The other ligament is between the upper pole and the fallopian tube, and this is suspending, it is holding it like this, isn't it? It is suspending the ovary, so it is called suspensory ligament of ovary. So these were the ligaments of ovary. Now you know the लोकेशन ऑफ ओवरी, ओवरी कहाँ प्रेजेंट है, अब आपको पता है शेप क्या है ओवरी का, ओवरी के मॉर्फोलॉजिकल एनाटॉमी पता है आपको मैक्रोस्कोपिक, कि उसके दो पोल्स हैं, दो बॉर्डर्स हैं, दो सरफेसेस हैं, किससे रिलेशन है. देन यू ऑल्सो नो अबाउट द लिगामेंट्स विच आर होल्डिंग इट, राइट? सो नाउ what else you have to know about it? You have to know about the other relations too. See, the peritoneum, you know, it is covered all around, but one important structure which is covering, except the lower pole and the posterior border, the whole ovary, is the fallopian tube. It is covering, it is near the upper pole, so it is related to the, it is covering it. It is covering the anterior border, it is covering the medial surface, it is covering the portion all around. except this lower pole and the posterior border. So this much you know, but like all organs, ovary also has a blood supply, it has lymphatic drainage, it has nerve supply. So what is the artery, or what are the arteries which supply ovary? As the name suggests, ovary, so the main artery which is supplying it is ovarian artery. So ovarian artery is the direct branch of abdominal aorta. The other artery which also supplies it is uterine artery, which gives, uterine artery supplies the uterus and it gives some branches to the ovary. And it is vice versa also. The uterus, it is mainly supplied by the uterine artery, but it is also supplied by some branches of ovarian artery. Now the venous drainage. The veins which come out from the ovary form a plexus, and that's called pampiniform plexus, which join together to form a vein called ovarian vein. On the right side, ovarian vein will drain directly in the inferior vena cava, but this is not so on the left side. On the left side, the ovarian vein will go straight up towards left renal vein, and it will open in the left renal vein, and then the left renal vein will open in the inferior vena cava. Clear? So arterial supply is clear, venous drainage is clear. Now lymphatic drainage. Lymphatic drainage, as it is getting its arterial supply from the direct branch of aorta, so the lymphatics will also go there only. So pre-aortic and para-aortic lymph nodes, they are going to drain the lymphatics of ovary. Nerve supply, it has got both sympathetic and parasympathetic nerve supply. Parasympathetic is vasodilator in nature, and sympathetic, it takes the pain sensation from the ovary. So if we have got a twisted ovary, or some follicle of the ovary has twisted, any kind of thing which produces pain, that pain is taken by the sympathetic nervous system. Now the histology. Histologically, you know, it is the outer layer is germinal epithelium, inside it tunica albuginea, and after that you will see the cut section here. What we find is the outer is the cortex and the inner is the medulla. The same you have read in many places. So the outer cortex contains many follicles. You can see here immature follicles, Graafian follicles, and this is a mature follicle. So follicles, all the follicles contain a primary oocyte in different stages of development, and in one cycle after the adolescence, before the menopause, every month one follicle, it matures and gives out a primary oocyte, and it is ruptured and it gives off the oocyte, which is taken up by the fimbria, and then the remaining follicle forms the corpus luteum. So before this ovulation, the hormone which we find is estrogen. So we call it estrogenic cycle. First 14 days before the ovulation are known as estrogenic cycle, because estrogen hormone is maximum in concentration. But this corpus luteum, it forms progesterone. So the next 14 days after the ovulation are called progesterone phase. So if the fertilization occurs, the progesterone will continue to be secreted by the corpus luteum. But if the fertilization doesn't occur, the corpus luteum will disintegrate. and then again the new cycle will start after this endometrium of uterus is shed off in menstruation. So again the new cycle will begin. So this was all about the anatomy of ovary. Thank you.